I'm David Kalema. I have a PhD in addiction treatment. Yeah, thank you. I don't know whether there are so many of those in Uganda, so I really appreciate the clap. Thank you very much, Drugs Apana, for giving us this opportunity. And as Hope and Beyond, we have been part of the National Prefects Conference since its inception, and we are so proud that it's making leaders. Besides my qualification, I have been in treatment for 20 years. So for 20 uninterrupted years, I've been seeing people with drug use problems and helping them get out of it. I'm also proud of that. If you can go to the next slide, that's our home to be. We are currently located in Wakaliga, but we are building a home in Mpigi, which we want to be a state of art for treatment, research, and training. So if you are interested to help other people with this problem and you need some professional competency, we will welcome you in Mpigi. A lot has been talked about drugs, and mine is really like a recap. And I won't go into the basics. I know that you people now know what a psychoactive substance is. Yeah, something that changes your mood and your brain and affects your behavior. And I guess you know the difference between abuse and misuse or use. Yeah. I'm talking about effects of drug abuse on mental health by giving you a few examples of common mental illnesses that we are seeing directly attributable to drugs. But for you to understand this, you need some basic understanding of how drugs work, basically, because psychoactive substances affect the brain. So they affect the brain in different ways. Either they can stimulate the brain, make it move faster, and the entire nervous system. They can depress it, make it move slower, or they can just kill the pain. We call those narcotics, opioids, or they can make a person hallucinate, see things which are not there, hear voices. That's hallucinations. So in a basic way, that's how drugs transform the brain and central nervous system. But of course, it can be broader than that. The impact can come in two forms, either as a result of intoxication, which is poisoning, or withdrawals. And poisoning can be acute or chronic. Acute is, for example, if a person is binge drinking and you take so many bottles of alcohol and you can see a person changing form. That's acute. They've taken it in big quantities in a short time. Or chronic, built over time. You see someone has been drinking alcohol for 20 years and they develop some symptoms. But also they can come in form of withdrawals. When a person stops using. If a person has been using these drugs, they become dependent on the drugs. It's like their body cannot do without the drugs. So when the amount of drugs in their body go down, then they start behaving abnormally because the body is no more with the drugs. They are used to drugs. You understand? Eh? So we call those withdrawal symptoms, such as craving, restlessness, insomnia, they can't sleep, and others. And some of them begin at the onset of drug use, and others come later. So we have addiction and dependency has been talked about. The mental effects, the effects of drugs on a person can even, some of them can go a lifetime. That's why we are telling you, do not start. Because you may be the unlucky one who may be cognitively impaired for your lifetime. And 20 years I have been treating people with drug use disorders. I've seen some making it And I've seen some not making it. And their parents have tried everything you can do in this world. They've taken them to rehabs in and out of Uganda. They've tried all the prayers. They've gone to witch doctors. It has not worked. And some die. How a waste it would be to lose you after listening, after attending this Drugs Apana conference. And if someone already has a mental illness, by the way, mental illness, let's start to treat mental illness like any other illness. It can be like malaria. It can be like, talk about any illness you know. If some of these illnesses are passed on in families, so if your father, mother, whatever, someone in the line has ever suffered a mental breakdown, you are also prone to that. I'm not scaring you, but I just want you to know that, and it's not the only condition that can be passed on by parents or genetically. Diabetes and so many others are. But if there is already a mental illness in the family and the person takes drugs, then that is exaggerated. So drugs can lead to mental illness, but they can also exaggerate the mental conditions, depending on which drug you take. If you take uppers or stimulants, which excite the central nervous system, we shall see what it does. And when we talk about the stimulants, we're talking about cigarettes, cigars, we're talking about tobacco, we're talking about including e-cigarettes. I'm bringing back these slides so that you can see that when we talk about drugs, we are not only talking about the marijuana stick. Even these, there are some, we call them e-cigarettes. They are like pens, like this, and someone is smoking. They have the same impact. We are talking about Cuba, which is even more dangerous, which is even, it's nicotine, but it can have more devastating impact than just someone who is smoking. We're also talking about some other stimulants which you have to be careful about. Like coffee, we take it often. Like energy drinks. So I'm just saying you have to go slow and be careful before you take such drugs. We are talking about hard drugs like cocaine, mayurungi, amphetamine. Some of these drugs come in form of tablets, others come in form of powder. Depressants are drugs that depress the central nervous system and the brain. They depress the thought processes and someone just goes down. Alcohol is one of them. And then we have others like benzodiazepines and others that come in form of tablets. I don't have time to illustrate to them. Then pain-killing drugs, especially administered in form of injections. I cannot go without cautioning our sisters that some of you naturally experience painful menstruation periods. Be careful not to prescribe for yourself the most effective painkiller. Otherwise, you might administer to yourself an opioid on which you might get addicted, and you get even a more serious problem than just the menstrual cramps. Some of these opioids come in form of cough syrups like codeine, and you also have to be careful what kind of cough syrup you are taking. So now I conclude my presentation by picking out specific effects. Okay, one more drug is the hallucinogens. Okay? Just allow me to show you examples of hallucinogens. You see those are mushrooms. You know, our forefathers were very wise. They would say, these mushrooms are poisonous. Later, I will give you the effects. And some hallucinogens come in form of what? Of tablets. I'm just running through them because of time. So, now you know the stimulants, you know the depressants, you know the hallucinogens, and you know the opioids. So, stimulants in common, they have the following effects: psychological changes, mood disorders, and insomnia. Because they excite the body, a person will not sleep, will not easily sleep. And sometimes they will have to take other drugs to sleep, like depressants to sleep. Paranoia, thinking that they are talking about them. Every time, maybe people are having a clique there, they are banging their KB, this guy thinks that you are actually witch hunting them. So they always have that kind of. Then anxiety, restlessness. They cannot even sit in one position for 10 minutes. They can't. Then we have irritability, highly irritable. Anything disturbs them. Then we have formication. Someone feels like something is moving or crawling on their skin. And there's nothing, but they really feel like an insect is moving on their skin. So those are the most common effects of stimulants, at mental effects. Then depressants, they have what we call a paradoxical effect at high doses, because we know that when someone takes a drug like alcohol, which is a depressant, they're supposed to go down. And we've seen them. After taking few doses of alcohol, you see them staggering, walking zigzag, sleeping in bars. But in the end, some of them even become aggressive and they start fighting. Then lack of inhibition. Someone can do whatever they feel they want to do. I attended a graduation party where a father of the graduate took alcohol and decided to go and pee right in front of the serving place where they were serving food. It was a scandal. Because at that time, their senses have been inhibited. And some of you have seen these things. Depression, anxiety, suicidal ideations. Alcohol and depressants are a leading cause of suicide because they lead to depression. Opioids, mainly those ones that kill the pain, are also commonly known for memory loss. This is my second last slide. Hallucinogens. Ladies and gentlemen, these are the most versatile drugs. All drugs are bad. All drugs are what? But never get near hallucinogens. You remember hallucinogens? We talked about mushrooms. We talked about LSDs. We talked about drugs like ketamine, which are actually used in surgical procedures. Someone can get vivid mental images or a distorted vision. So I am here and you could see me. Instead of seeing me standing, this is what, horizontal? This is vertical. You could see me standing horizontal or at 45 degrees. So some of them will walk like this. For you think that they are actually on vibe. So some of them, they are bouncing, but actually they are trying to find their what? Their vision, because they are seeing you standing at 45 degrees. They have to place you back. Altered space and time perception. Someone may not know that today is Thursday. Someone may think that we are right now in Gaza, that we are in Washington, and they will convince you. Someone will think that they are the president of Uganda, or the president of Libya, or any other country. Someone will come and say, I am Jesus Christ. I am the Savior, me. Distorted sense of body feeling. Some can feel that they have too much weight. Others can feel that they are light. They can even fly. Loss of reality, melding past experiences with the present. Did I eat? Didn't I eat? Did we have breakfast? Meanwhile, you are having supper, and then they are saying, okay, this breakfast has been what? Delicious. Preoccupation with the trivial thoughts and objects, something very small. Seeing an insect, seeing a bird flying, and it takes all their time. Thank you. I'm being told it's almost time. Intense emotions. Okay, so then we have dreamliness, introspection, hallucinations, difficulty in focusing. Finally, we have bad trips. Allow me to talk about just these 4 points on this last slide.
2 seconds.
Thank you. Bad trips, including frightening hallucination, confusion, disorientation, paranoia, agitation, and panic and terror. You are talking to someone, and all of a sudden, they are confused. They have been coordinating very well, and all of a sudden, they are confused. They are in terror. But to go back, Babo Wajja, the building is catching fire. Prolonged psychotic state similar to paranoid schizophrenia. Usually, a person suffering from schizophrenia exhibits some disorderliness and disorganization. Maybe they are not combing, they are not what, they are not taking care of themselves. Impaired reasoning, and lastly, flashback, reoccurrences of certain aspects of the drug experiences may occur and felt within a few days, and sometimes even a year, you get the flashback. And you really feel like you are going through those symptoms I've talked about a year after you last used some of these drugs, like LSD. So in case you have any question or any challenge with the drug abuse, with the drug use, I have a team. I have a counselor and someone who was formerly using. Good enough, she's a lady. So girls, don't fear to go for counseling. There is a desk for Hope and Beyond. You have a problem at home. Teacher, you have a student that you want to support. Please come to our desk and we can discuss more. Thank you very much.
Thank you so much, Dr. Kalema. That is Hope and Beyond. It's a rehabilitation center